Complement and Plant-Based News present Plantapalooza. Join me in welcoming Dr. Joel Kahn with a primer for this year's Plantapalooza Longevity Festival. What's the role of nutrition in longevity and chronic disease prevention?
Well, I got to tell you, after practicing cardiology more than 30 years and studying nutrition more than 40 years, I am what's called an interventional cardiologist, board certified interventional cardiologist. And to most doctors, and certainly most cardiologists, interventional cardiology is to use balloons and stents, and I'm trained in that. But I intervene with food. I intervene with whole plant-based food. And I am back in my roots of interventional cardiology using lifestyle. Why do I do that? Because according to science, the number one input on avoiding chronic health issues, chronic diseases, talk about brain deterioration like Alzheimer's, talk about type 2 diabetes, talk about a variety of cancers, certainly breast cancer and prostate cancer, and talk about the big one, coronary heart disease, my specialty. They all relate to poor nutrition choices, access to poor quality nutrition foods, dependence on hyper-processed, ultra-processed fast foods, grocery store frozen meals, things that come in paper boxes and plastic wraps. All those foods are the number one cause of chronic diseases. You have to be a qualitarian. You want to eat quality foods. You want to eat whole foods. You want to eat whole plant-based foods is the most powerful intervention you can have to avoid high blood pressure, avoid type 2 diabetes, avoid a high cholesterol that might require prescription drugs, and avoiding the actual diseases, diabetes type 2, variety of cancers, as I mentioned, deteriorating memory and brain health, and finally, obstruction of your arteries throughout your body, leading to risk of heart attack, stroke, erectile dysfunction, poor circulation in your legs called claudication. You can do all that by starting as early in life as possible with being a qualitarian, eating the best foods, even if you got to eat a little less, even if you have to pay a little more. Although there is recent data that whole food plant-based eaters actually save money monthly, substantial, hundreds of dollars a month, compared to going to the grocery store and buying meats and cheeses and eggs and poultry and the rest. Don't do that. Save money. Save your health. Use nutrition as a powerful tool and you will thrive. It happens, it's science, and I've seen it in my decades-long cardiology practice.
What are the most impactful foods in a healthy longevity diet?
We have strong science as to what are the most helpful foods to add to your diet and the most important foods to delete from your diet in order to prevent chronic diseases. Just as an example, there's a massive international study called the Global Burden of Disease Registry, GBD. For over 20 years, they've been providing very important nutrition information and health and disease follow-up all over the world in dozens and dozens of countries in massive numbers. So they reported last year that there are 3 foods that add to your longevity more than any others. And they could have picked anything. And they picked, number 1, whole grains. Whole grains add a few years of longevity just by putting them in your diet. Enjoy your whole grain breads, your whole grain pastas. Bake with whole grain sources. Number 2 was actually nuts and seeds. Nuts and seeds add a couple of years of longevity to your life and avoid disease. So be sure to add them in. I like, raw walnuts as my favorite example. And the third was the famous legumes, the beans, the peas, the lentils, also add a couple of years of longevity. Now, if you do all 3, you're really going to get years of benefit and avoidance of chronic disease. What were the next 2 on the list? But these were in the bright red warning, warning. These rob you of years and rob you of health. They were all red meats and processed red meats like bologna, salami, hot dogs, and pepperoni. They lost years from your health span and your lifespan and contributed to diseases like type 2 diabetes, coronary heart disease, dementia, and colorectal cancer. And just below them, we're back to the good news, was fruits and vegetables. They add longevity to your lifespan. But interestingly, the whole grains and nuts and seeds and legumes were the most powerful group. If you want another little easy to remember mnemonic, you use the mnemonic G-bombs. You've probably heard of G-bombs. Greens, beans, onions, mushrooms, berries, and seeds. And adding G-bombs every day to your diet, no matter what else you eat, can be healthy and promote the avoidance of chronic disease. You don't want to get that type 2 diabetes, those cancers, those deterioration of your brain health. And you certainly don't want to get my specialty, coronary heart disease, the poor circulation throughout your body. So eat smart, eat intelligent, and eat quality.
How does your family's health history impact your approach to nutrition?
Some of you have a family history of heart disease. Mom had a stroke, unfortunately. Dad had bypass early in life. Brothers or sisters are known to have high blood pressure, high cholesterol, and maybe actually have heart disease. So number one, be sure you get checked. And as a cardiologist, I got to tell you, you have access to a test that can screen you for silent heart disease called a heart calcium CT scan. It's an inexpensive test. It's available at almost every hospital in the Western world. In the United States, it's about $100 out of pocket, except in Texas, where it's covered by insurance. Heart calcium CT scan. You want to be a 0. And if you're a 0, it's really good news for your health. But if you're above 0, you want to focus double, triple, quadruple energy on your entire lifestyle. But you certainly want to use a nutrition approach. So if you have a family history of heart disease, do what I say on social media, hashtag test, not guess, and get checked. And then you want to throw in the nutrition. We know the nutrition that prevents heart disease. We know the nutrition that prevents type 2 diabetes and certain cancers and deteriorating brain function. And they all revolve around a whole food, plant-based, rainbow diet, brightly colored, a variety of fruits and vegetables, whole grains, beans, peas, lentils, soy products, nuts, and seeds. You want to concentrate on eating those foods for your 2 or 3 meals a day, and you will enjoy health, and you will avoid disease, and you will maximize the chance you're going to have a great health span. Enjoy your life without a need for surgeries, medical visits, and prescription drugs as much as possible. That's what you do.
How should I change my approach to nutrition as I age?
Let's just say you know you have a cardiovascular issue. Maybe you've been diagnosed with high blood pressure. Maybe you are aware of prediabetes or diabetes type 2. Maybe your cholesterol is high. Maybe you're dealing with a weight issue. Or maybe you actually know you have actual coronary heart disease. You've had perhaps a heart attack, a bypass, a stent, or my absolutely mandatory screening test, a heart calcium CT scan, and it came back elevated. So you want to double down on proven science. You want to know the science of Mr. Nathan Pritikin and the famous Pritikin Longevity Center and follow their program and their published results, which are actually amazing. In fact, they're even reimbursable to learn the Pritikin program through insurance covered programs. You want to know the absolutely milestone research of Dr. Dean Ornish, MD, and the lifestyle heart trial and the way he approaches diseases throughout the body, from heart disease to prostate cancer, and now his ongoing research in brain disease using whole food, plant-based diets, plus a strong lifestyle program of stress management, yoga, breathing, meditation, walking, and social support. You want to know the amazing research at the Cleveland Clinic of Dr. Caldwell Esselstyn and his whole food, plant-based diet approach. And finally, I have to give a shout out to my colleague, Dr. Joel Furman, MD, in his work with the nutritarian diet and published data on heart disease patients. So if you know you're dealing with a medical problem, you want to use nutrition as a powerful tool. You don't want to make compromises. You don't want to say, I'll do it some of the time, or I don't feel like it, or it's vacation, or it's Thanksgiving. No, you do it. You commit yourself, and you'll enjoy the benefits. You'll see the lower inflammation. You'll see your blood sugar drop. You'll see your cholesterol drop. You might see your waistline get thinner. Your energy goes up, your sleep improves, and hopefully your overall health improves. So you may need more than nutrition, but nutrition is the strongest hammer in our toolbox. Be sure to grab it and use it 2 or 3 times a day, depending on how many meals you eat. Nutrition is the king. Exercise is the queen. There you go.